All right, so today we're excited to sit down with Carl Gustafson, Director of Physical Therapy in the Sports Medicine Division at Boston Children's Hospital and a leader in performance and rehabilitation. With over 3 decades of experience as a physical therapist, athletic trainer, and strength conditioning specialist, Carl has worked with everyone from youth athletes to elite performers. He founded a multi-clinic physical therapy practice and continues to push the field forward through his work in injury prevention, strength-based rehab, and more accessible care through his app that he recently launched, TherexPT. But beyond his career, Carl has built his life around caring for others, not only through his work, but through his role as a father and a husband. He's a father of 6 incredible kids, a devoted husband, and to me, more than a neighbor, he gave me a second family. He leads by example, showing what it means to be hardworking yet humble, consistent, and to truly care for the people around you. He's the kind of dad who, no matter how busy the day, always made time. Whether that meant stepping in as a soccer goalie as his kids practiced their shooting, playing basketball each night, going for a run with his wife early in the morning, or simply being present. His quiet presence alone has a profound impact on those around him, inspiring others to become the best version of themselves. I can say with certainty that he was one of the first people in my life to show me the importance of self-care. The idea that taking care of yourself allows you to more fully show up and care for others. Carl is the definition of someone who is gentle, humble, and kind, and we're so excited for you to get a glimpse into the way he lives his life. We hope you walk away as inspired by him as we are. So with that, let's get into it. Carl, our first question for you is, who are you, what do you do, and why do you do what you do?
All right. Well, thank you for that beautiful intro. I think we could just probably end it right there. But no, so I'm a physical therapist, an athletic trainer, and a strength coach. And if you kind of think of it, the athletic trainer is the person who identifies the injury on the field. Then they typically send someone off to a doctor. The doctor then sends someone off to physical. The doctor will send the person off to physical therapy. And then last, the person will, if they wanted to try to better themselves after the injury and they recovered, they might go to a strength coach. So I feel like having all three certifications and worked in all three aspects of that, that's allowed me to have a better idea and appreciation of what each of those do and the pitfalls of each of those professions and how they should in the medical world overlap more, but they don't because there's kind of silos, if you will, where the athletic trainer might not communicate with the physical therapist might not communicate with the strength coach. So I've really enjoyed being tri-certified that way. And it's allowed me, when I had owned and operated my physical therapy practice, to be able to appreciate the people I needed to hire to really feel like I had a complete practice.
I love that. I think that's great. I love that. And why is it that it's like so siloed? Is it just like it's always been, or it?
That's a great question. It really should be that physical therapy and athletic trainer should be a dual certification or, college degree. It should be that the person who's identifying the injury and then rehabbing the injury. Now, don't get me wrong, athletic trainers in a college setting and in very many states in professional setting, they do everything A to Z. But in the typical community setting, the athletic trainer is very separate. Usually the school has very poor abilities to have the resources they need to have enough for the athletic trainer to have assistance with them. So they typically are trying to get kids ready on the field. They're trying to triage everybody, get them on the field, get them ready to play. So they don't really have the time to be able to rehab them. And then consequently, I say this to physical therapists all the time. I say, I can say this to you because I am a physical therapist, but physical therapists, they don't know how to identify problems on the field. But at the same time, when it goes through rehab, they can take people to a certain degree, but then they don't typically have the knowledge base of what a personal trainer does on the other end of it to really take them to the next level of fitness. So I think some of it's just political. The athletic training world, in terms of licensure, and the physical therapy world has, at least in Massachusetts, has always been kind of butting heads about what people can do and what people can't do. And then I think there's also a little bit of pride that some people don't want to admit that they don't know, and they don't reach out to those people that they're working with to really share athletes' true story. One of my old partners in my company, Scott Waugh, he was the athletic trainer and physical therapist for the Bruins and the Red Sox. And, and he used to always say, when everyone else is driving home after the professional game is on TV, he goes, we're down the medical room assessing everybody to get ready the next day, so that the athletic trainer and the doctor and the physical therapist were creating a plan within 24 hours. And that's really what sports medicine should be, but really it's not because people will sprain their ankle. They have to go to their primary care doctor. By the time they get to their primary care and get to physical therapy, I mean, the kid could be out of the whole season. So there needs to be improvements in the flow of getting people to the next level.
I feel like with your first answer, you're already giving a glimpse into the reason we brought you on. So many different things that we want to talk about, your career, like the business mind, even with your answer and how you answered Kayla's question. But we want to bring it back to the beginning too. So way back to your early life, because I think a lot of people, even maybe Kayla and myself included, don't know much about that. So can you give us a little glimpse into like where you were raised, what your family life was like, and then kind of maybe what led you into this direction in the first place?
Yeah, that's a great question. I was born about 25 miles north of Boston. I married a girl that lived 25 miles south of Boston, and now we live about 25 miles southwest of Boston. So I always say that I could be a cab driver if I didn't wasn't a physical therapist because I know every street in Massachusetts. I growing up, I was just me and my sister and my dad. My mom had passed away when I was little. I was thinking about this earlier today that in those days, think with technology being what it is, people today are watching other people. And back in those days, you didn't have that. So you just kind of dreamed of what you wanted to do. And I think that probably gave you more goal setting things to do. So when I was a kid, my uncle used to come over and bring comic books to our house. You're probably saying, where is this guy going with this? And when he came over one day, he brought this magazine. And this was literally, I am not kidding you. And I can show you, I'm in our weight room at home right now. He brought a magazine over and it had all these different bodybuilders. And it had, it was supposed to be within comic books, but it was actually all these bodybuilders. And I saw it and I was like so amazed that these guys could build their bodies and look like that. I still have the magazine. And at that point, I was literally, I think, third or fourth grade.
Wow.
And I asked my dad that I wanted to get a weight set. So he got me a weight set for Christmas. I still have the weight set too. As
No
my wife
way.
tells me, I'm a pack rat. But I have that little 20-pound weight set that you could put the little plates on. And that began my quest and my just love for lifting. Now, it also tied into the fact that my dad was a World War II guy and he didn't really understand sports. He went into World War II at 17 years old. So when everybody else was signing up for basketball, football, I had to make sure that, things were done, right? The lawn was mowed, the garage was clean. So I found kind of this place where I could work out and do everything I needed to do and be able to have enough time later to go out with friends. But I felt like sports weren't looked at in our family like something that you wanted to aspire to. That was like kind of things that you did with your free time. And your free time was more spent trying to make sure that the lawn was mowed and the grass was clean, done the right way and everything. So I found not only was weightlifting a place for me to go and enjoy, but I just happened to be good at it. Now, I don't know whether I was good at it because I started at such a young age, but I always say I was good at baseball and good at football, okay at football, but I was just really good at working out. Every time we'd go to the gym with friends, whatever else, it just seemed like I knew what I was doing. So consequently, this is kind of the weird part of it is this is the 90s, but gradually I ended up getting into bodybuilding. And as I got into bodybuilding and started lifting more and, it's kind of a weird sport, right? People asking you to take your clothes off. People would see you and say, hey, you look great at this. You should enter Mr. Massachusetts contest. So I entered Mr. Massachusetts and I won the teen Massachusetts for my age. And then I went into Mr. More contests. And the next thing I knew, I was Mr. New England and College Mr. America. And, it just kind of evolved. And it was something though, but think of it, it was really interesting because it then segued into physical therapy because physical therapists can go to school for 6 or 7 years and they're not obligated to ever lift a weight. So I would watch all these people. Like I think if you went to a plumber needs to practice with pipes and a surgeon needs to practice with surgery. But with physical therapy, you read about it, but you don't actually do it. So it turned out to be that this thing that kind of started my childhood of what I did and what I found kind of a positive with when I was young actually turned out to be, I think, still to this day, my strongest aspect of what I know about physical therapy is how to work out. So it kind of just flowed that way.
Don't think anyone can beat you starting in 3rd or 4th grade. It's crazy. I love not crazy, it ended up working out. But I also love what you said about back in that time allowing space to dream. There was no road or people to always look to or kind of guardrails even then, so you were given this open book, and that cartoon book kinda or comic book kind of propelled your career and ended up where you are today. That's pretty incredible. One thing we know too, you lost your parents at a young age. We weren't sure if that shaped whether it was your bodybuilding or your profession or the way you are a father today.
It's funny because I had a patient once and she was into astrology, ironically, but she was amazed that I went into physical therapy because I lost my mom, and my sister went into nursing because we lost our mom. And she's like, that doesn't usually happen that way. So I guess if you looked at the norm, you wouldn't think that somebody who had lost their mom would go into a helping profession. But I think that that has evolved. I think that the person I was when I was in high school and in college was looking more at who I was lifting weights as opposed to helping people. And as I evolved and met my wife, who is the saint, um, and um, and I saw what people go through. Working at Children's Hospital, like I said earlier, is very humbling. And so when you see what people go through, trying to help people, I think is just gives so much reward and energy to yourself, whether you're not in a medical field or not, just going out and helping and giving back to people, I think probably is more rewarding than just about anything.
I feel like you are the epitome of somebody who's caring and who's made to help and serve other people. And then I know it doesn't surprise me that you met Nikki because you guys are two of the most caring people. But I think it's interesting to hear how you say how it started as like your own passion and kind of your own experience of bodybuilding. And then that kind of drove you to realize like, oh, this can be a career. And then that experience at a young age shaped your career and allowed you to kind of go further and set you apart from like other people who, like you said, are studying the books and understand kind of the mechanics of it, but haven't really had that true experience to relate to. Did you always know that you wanted to have a big family? And like what has it been like the most rewarding parts about having a big family, being a dad, and what have been the most challenging parts to navigate as a father?
Yeah. So, the answer, as a kid growing up, I was very jealous of the kids that had tons of brothers and sisters, and it was me, my sister, and my dad. So I felt always excited when I would go over friends' houses and there would just be so many people there. So yes, in the back of my mind, I always thought to myself, that would be cool to have a lot of people in the family. So I didn't know how it was going to evolve that way. But then, I guess because a lot of people say, oh, I don't know if I'm going to have kids before they're married. But then once I met Nikki and we, decided that we were going to get married, like I just knew that she was the person that was going to propel me to that next level of wanting to have a big family. And yeah, but I think I always, even to my own kids now, I say, look, just take one kid at a time. I mean, we've been blessed with having kids that have, small little issues as they've been growing up, but nothing big. So I could see how someone might have a child and then something medically might happen or economically might happen to them, and they might only decide to have one or two kids. And I totally get that. I think my biggest advice to anybody about thinking about having a big family is look, just have one and see if that works. And then if you can do that, then swing two. And if you can swing two, but not to come out of the gate saying, I'm going to have 6 kids, because I never would have thought that that was going to happen. I thought after 3 that we were done, but it just kind of kept going.
If you could look back and think about like what lessons or habits that you wanted to teach your kids growing up, as you mentioned before, you're like, oh, I didn't have the like free time to like get involved in all the different sports that there were, like, and you gave that to your kids, but you also had, I think it may go unnoticed by you, but that like discipline of regardless of having to do the dishes, do the laundry, take care of the house, and like do all the work that you needed to do, you always made time, even at a young age, to lift and work out. So I think that's like more unique to you than you think. And I think that's something that even just as your neighbor and how I've seen you show up for your family, that consistency in like everything that you do, and just like whether it's consistent in working out and taking care of your body, the food that you eat, but also just like consistently showing up for the people that you love and being there and guiding them to be the best version of yourself so that they can be the best version of them is like so unique to you, and I think it's so impressive. Is that like beyond, and I'm just like curious, is that something that you consciously did? Like was like being consistent and you wanted to be somebody who showed up always, or are there other lessons that you went into fatherhood being like these are core aspects of who I am that I want to pass on to my kids? And if so, like what would those be?
That's a great question. I mean, I think that to a certain degree, I think that fitness is something that just makes you feel good. So I think once people realize how good they can feel by being fit, that will help them. And so I think, as I always say, I feel terrible. I don't feel good if I eat like too much junk. I love junk food. I love the taste of it, but I try not to eat that much of it. But I will. I'm not so like, oh, I can't eat that. I can't eat this. I'll eat some of that, but then I'll feel like if I can work out and have the reward of being able to have had it, it'll be interesting to see with everybody now taking all the different weight loss drugs. I'm hoping that instead of everybody saying, oh, they're just going to put more weight on once they get off the drug. But I'm hoping that those people will feel really good about how they feel, truly feel, so that they won't need to go back on those drugs, because it's kind of like a high, if you will, that they never had in their life. They might have had a high of eating something, and now all of a sudden they've lost all this weight and now they feel much better by not doing it. But I think also in physical therapy and in my lifting is that I feel like so many people don't look at it as though, like, I really feel like the three core things of fitness are strength, flexibility, endurance. And, the football player has a lot of strength, but no flexibility. The dancer has a lot of flexibility, but no strength. And the yoga person has a lot of flexibility, but no strength. So, or cardio. So I feel as though I try to tell people that everyone's activities or what they do fit into this fitness continuum. And if you address it, that the yoga person needs to do more strengthening and the football player needs to do more stretching and cardio. And I feel if people do that, they'll see such rewards with less time spent, but people get into what they are. Oh, I'm a yoga person, or I'm a Pilates person, or I'm a pickleball person, right? And so if they realize where that sport fits into the fitness continuum of what it doesn't have, then I feel a lot more people could get fit with such little effort. But people just tend to, I'm a golfer, I'm this, I'm that. And then they don't realize that the reason why they're not fit is because they don't add those other aspects in. And with my kids, I think just us always being active around the house just demonstrated to them that you just kind of do these things. Like we didn't force it. We didn't say you have to go out and run or you have to go out and lift or anything. But I think that just by them watching us and I think that, what they always say, it's better to see someone doing it as opposed to just saying to do it. And
Yeah.
I think that's even spiritually within our home, like just being nice, being kind. I feel like people, we saw each other a lot growing up at church and everything, but I feel like people go to this place for 1 hour a week and then they leave this place after an hour and they don't do anything really nice when they're outside of there.
Yeah.
So I feel it's the same almost with fitness, is that it's pretty easy if you just kind of realize that being fit feels good and being nice to people feels good. So I
Yeah.
think as more people do that, they'll feel good.
Yeah, I love that. I think that both the idea of just like do it because you'll feel how it feels for yourself and that's going to propel you to keep wanting to do it. So it's just taking that first step to like make the action. And I know you mentioned like the drugs that like lead to late weight loss, which I think it can be so beneficial for somebody to feel, because I think that's the kind of like that hump of doing something but not seeing immediate results can kind of set people off and not be consistent about it. But I
Mm.
think I like that point of yours. It's like do it. You'll feel good even if you don't see the results. Think about how it makes you feel, and then continue to show up the next day and the next day and the next day. And I think that's like such a great point to call out. And then I love the three aspects of fitness that you called out: the strength, flexibility, and endurance, because I think for so many people it can be daunting to be like, okay, I want to be fit, but what does that mean? And like, so then they're like, okay, all I know is weightlifting, so I go to the gym and I'm weightlifting, but I still don't feel good. Why don't I feel good? And then the same person who's like only doing yoga, but they like don't feel like they're strong and their bones aren't strong or whatnot. But I think it's having that holistic lens that you're saying is like the strength, flexibility, and endurance is such a good continuum to think about. So it's like, even if you are spending more time lifting weights and you are somebody who's playing football, you can't forget about the flexibility and the endurance. So it's how do I like weave that into my routine, and how do I kind of train harder in endurance when I'm in the gym most of the time or whatever. But I love that. I love those three, kind of calling out those three key pieces of fitness, because even for myself, I'm like, oh, like I feel like I'm active every day or whatever, but then I'm like, my joints feel tight or whatever, and it's like, okay, well, I should probably be doing more stretching. And so it's just kind of like keeping it in those guardrails versus being like, okay, what does it mean to be fit? And even if I'm doing what I'm doing, not getting set back by the fact that even if you're doing something every day, that you don't feel the best version of yourself. So I like those three a lot.
I have a
And
question.
then
I have a question about you talked about how your family's super active and fit because they saw it and they were around that. Can you speak to somebody who may have like not been raised by in an environment like that, or even some of your patients? Like, how would you inspire people to either find communities to be surrounded by that? Because it is so much easier to be surrounded and see the activities versus feeling like you have to be told. Do you know what I mean? Like,
Oh, yeah, totally. It's, because so many people, and almost everybody I see is injured too. So that almost turns out to be that this injured state person is almost like starting off with someone who isn't fit. So just showing them that, you can walk from your house, one house down, and then next time you go out and walk, you walk two houses down. So I think demonstrating to people that all you need to try to do is a little bit more each time can make it not so daunting. I mean, right now you go online and you see a fitness program and the person's yelling and screaming at you. I don't even like my kids laugh because I go on a Peloton program and I don't even have the volume on of the person teaching it. am watching a TV show or something else. I'm keeping my heart rate up and I know what I'm doing, but I don't like people yelling at me when I'm working out. I have people yelling at me enough. No, not I don't really have people yelling, but uh I feel as though if you put it in perspective to people that just, I always say one more than the time before. If you can do it, one more rep than what you did last time. If you can do maybe one more house down when you're going for your walk. And so I think you have to take that person and take away their fears because their fear is what's usually holding them back from starting, whether they're injured and they're fearful of getting off the crutches or they're fearful of just being kind of ridiculed or maybe people are watching them when they go to the gym or whatever else. So it's taken me from this high level of competition in weightlifting all the way down to the most minor level of what you would be thinking that people wouldn't be afraid of. People had asked me before, why do you have mirrors up in this place? I don't like you have mirrors up in your gyms where you work out. And I said, well, that's so you can watch your form. But so many people were more fearful of how they looked when they saw themselves in the mirror. So it's kind of like, perception is reality, right? Perception is your knowledge and your experience. And so as you work with people, I very often wouldn't take them in front of a mirror initially because I knew that they felt so bad about how they felt. So I would show them the exercises and then I would gradually have them come out into the gym setting because I knew if they brought them out into the gym setting right away that they would be intimidated.
yeah, no, I think that's great. I think what you said too about taking away their fears, I was actually just talking about this the other day with my dad and my sister, how much fear is so much built up into the mind. So I think even with your career and what you're talking about, like when you take it out of your mind and into actually what you're doing, and then you just do one more the next day, it's such a valuable thing. So we were talking about how went from your early life, we talked about how kind and giving you are, but we also clearly from your answers and the way you've talked in this conversation so far, you're extremely smart with what you've built with your business. But one thing I admire about you too is just your entrepreneurial spirit. You've built what you've done with the PT into so many different things, but then also just observing your family too. So you have so many kids. Christina's a nurse, but then even CJ starting his own podcast. Tyler, I think, is very entrepreneurial too and creative. And then Sophia, I remember with doing like the singing and everything. And you were always there to just inspire her. And I don't know so much about Ella and Maya just yet, but I'll keep an eye on them too. But whether, once again, if it's because they've watched you and they admire what you've done or you've instilled something in them. But I'd love to just hear about that. Like, are you supportive of them? Do you feel like, have you always been entrepreneurial?
Not really. Physical therapy is a field that there's only one path, really, two paths. The one path is you can work in a hospital rehab setting, or the other path is to go into private practice and open up your own place. You have really a ceiling on what you can make in a hospital or rehab setting. When I started to go into private practice, I realized that, okay, I'm going to come back to my kids in a second, and this will probably spill over to why I brought it up this way. But there's a guy named Jim McKelvey, and he invented Square, the little credit card machines. And he came up with this statement, which I really love, and it's called earned secret. So an earned secret is something that you learn about your job or your profession, and you learned it just because you were at your job and your profession every day doing the reps. You figured out something that was wrong actually with your profession. Yeah, I would look him up because it was really interesting. He wrote a book about it. But the earned secrets that I learned in my profession was, well, okay, I opened up a small private practice, and how could I grow that practice to the next level? I watched that every time a PT had a private practice and maybe he had one or two PTs, those PTs would leave and open up their own one. So nobody was ever having like a big practice because everybody would leave. And I looked at all these law firms and accounting firms. I'm like, how does everybody stay at these firms? And I realized that if I gave my PTs a percentage of the profits from any clinic that I opened, then I would figure out that they would stay. So one clinic led to two, and two led to three, and three led to four, and ultimately led to 22 clinics. And that was one of my earned secrets that I figured out. And I think my kids watching me be in private practice and be there every day. And I used to always say, don't ever when we meet people, I don't want you to say that person works for me. That person works with me, because I feel like I never wanted to be the boss. I said I wasn't the boss. I was just the person at the end of the month that added up the numbers and said, is there anything left? And I feel like by showing your kids that you were working with people and you had to have respect for those people who were working with you, and you had to reward those people, that I think that inspired maybe them to understand that working hard. They knew that I worked basically when I first started. And Nikki will tell you, my wife, I worked 12 hours a day. I used to work from 7 a.m. to 7 p.m. every day, just seeing patients. And then gradually, as I could hire people, I didn't have to work as much. But I think that's kind of where some of the entrepreneurial spirit maybe came. They saw that there was a profession that because people always say, well, you're a physical therapist. Wow, you've been pretty successful. How did that happen? And so I think it was just from looking at what was missing in the field. And then by doing what was missing, that allowed me to be successful with it.
And your kids have definitely done that too. Do you feel like you've supported your kids too, or you're saying it's just from them watching?
Yeah, I think I like to say I inspired them from them watching more than from me saying, because, and I used to always say, I said it, I said it specifically, probably more to the boys than the girls because they were my older kids. I said, there's like three ways to, be able to get to the next level. You either have to own it, you either have to own stock in it, or you have to have some kind of pension. And if you don't have those three things and you're just collecting a paycheck every week, I learned so much from my patients. One of my old patients said to me, he goes, remember, you pay your bills with your check. He goes, but you make your money on your deals, meaning that when something happens, an event happens, you sell your company, you sell your stock, you have a pension at the end of your career. That's when you actually will be able to survive on that. But day to day, week to week, your paycheck basically pays your bills. And that's why I feel bad for a lot of people who are so unhappy with the United States right now, because they feel like the government owed them something. And granted, the government owes people to get them on their feet. And I think the government really owes people to do that. People need help getting on their feet. It's not their fault that maybe something tragic happened in their lives. But then once people are on their feet, I feel like the United States is a pretty cool place that you can do anything you want. But I do believe that people need to have help in the early stages of, whatever trauma they've had in their lives. And I think the kids have watched me and Nikki preach that. So I think they see that we're capitalistic and we're entrepreneurial in our house, but we are the first ones to say, we got to help those people.
Yeah. I think you guys are like the best image of what that means. Seriously. Like it's very admirable. And also just one question to go back to when you were being an entrepreneur and building that practice, was it tough to balance that with practicing and being like a physical therapist? And like how did you balance that too while you're building these like a bunch of clinics around New England, but also continuing to practice?
And being
That's such a great, you're taking me down memory lane, because there was a key point in the career where after you would treat, should I continue to treat and be a role model and a mentor to everybody that I work with, and the doctors that refer patients know that Carl is still treating and he's always the person we can call at any time to say, hey, why is this person in the Brookline clinic doing this? Why is this? Why is that? Or should I go in the back room and start doing business stuff? And I said to myself at that key point, I said, you know what? I can hire someone to do the business stuff, but I can't hire someone to be a mentor and to be the right-hand person talking to that doctor. So I said, I'm going to stay on the floor. I ended up hiring one of my college roommates, and he became my business manager, who helped me out greatly for 12 years. And And I feel like that was the right decision because it allowed me to still continue to see patients, to be the figurehead for the company, but at the same time, know, the old saying, don't expect what you don't inspect. So I would always make sure that I knew everything about the business. I knew the billing.
Yeah.
I knew from collecting the copay to collecting past due bills. I knew all of that. I used to call it the road to $90 because that's how we figured out how to collect each visit. But I hired other people to do it. And guess what I did with all those people? I gave them a bonus because how can you expect someone to collect $5 at the front desk for a copay? Is I would give them a percentage of the $5. So that way I knew that everybody in the company not only was getting a salary, but everybody was getting a bonus plan. And I really felt like people appreciated that. They
Yeah.
worked together to try to make it work.
Yeah. I think that's it's like when you make people feel valued and like they're part of the bigger picture and the end goal, it's you're going to be there's going to be more of a team and you're going to like all become better together versus just like one person trying to do it all on their own. And I think the point that you brought out around you have these skills, you have that experience and to your point like you're the one who like has the actually practicing experience but also the knowledge and the schooling of everything and that's pretty unique. So to know that about yourself and to be at such a level of a clinician that you are, and to then be building this multi-site clinic, to not get distracted from the fact that, "Oh, I could just run this whole clinic by myself, and then I can sell it, and then I can be here in whatever place and, like, make whatever money." But you also you stayed with the career and, like, the skills that you have, and you didn't kind of just, like, go away and just be like, "Oh, I made it to this place and now I can kinda move on and just, like, focus on the business." I think that so many people will kind of disregard their own passions and their own skills that they were, like, uniquely given and their experiences in life because they're just kind of blinded by, like, what could be financially or whatnot, and I think just the way that you were able to kind of merge the 2 together is so inspiring, and I think more people should be doing that, and I think you can succeed, but also not only succeed for yourself, but succeed with the people around you so much more when you stay true to your own gifts and your own skills and you bring those up with the people around you, then you're all kind of gonna go up together. So I think it's such a great story and it's inspiring.
I agree. It's like knowing your strengths because anyone could read a book or listen to a podcast on how to do what you did, but I don't think anyone could have done what you did because they're not you for all the reasons that we talked about, like even the type of person that you are and like father you are. And so that kind of leads us into another question we wanted to ask is what do you feel like separates a great physical therapist from an average one?
I think big picture would be that they have to be able to they need to first develop their skills. So the first few years out, they should try to align their jobs up with people that they think are good mentors for them to learn the aspect of physical therapy that they want to be in, whether it's orthopedic and sports, whether it's cerebral palsy, whether it's stroke rehab, cardio rehab, whatever it is, and really try to be better at that. But don't take anything anyone says as truth. I always say when I give a talk, I go three great things could happen today. I said, the first thing is you could say, when I talk, you could say, I knew that. Well, that's good. You knew something. You could say, I didn't know that. That's good. You didn't know something. Or third, which is probably most important, you could say, I don't believe that. And you question it. And nowadays, you guys can, right in the audience, can look up on your phone. And I always challenge people. I say, go look it up on your phone right now while I'm talking to you and tell me whether I'm wrong or not. Whereas in the old days, back when the internet was on paper, you had to go find a book to try to prove what was right or wrong. So I think being a physical therapist and not trying to be the best you can be, but what people tell you, don't believe it to be true. My dad used to always say, people tell you what they want you to believe. My dad, I love you, dad, but he was cynical. But it was, I always kind of had that type of side that when someone tells me something, especially about fitness, and nowadays with all these podcasts and everything else, it's just like they're just spouting out stuff like, again, they don't go back to the fitness continuum. The next thing you have all these people doing these heavy deadlifts because they're going to have good bone density, but they have never lifted a weight before. It's just like, okay, let's take it back a sec. So,
Yeah.
I think trying to figure out the plan of what the person needs makes a great therapist. And then, like I said, if you can't lift weights and you don't know how to work out at a gym, you are not going to be a good physical therapist. I am saying that right here. And I always say it to physical therapists, I'm being mean, but I'm calling you out. In
Yeah.
getting physical therapists to be on this, that's why you don't see a lot of articles written about studies by PTs because it's like herding cats. They all try to do the different thing of what they're doing, and there's not much continuity of care.
It's just I feel like you see it in a lot of different aspects, but it's kind of that holistic point of view is really where I think you told me this one time, and I think it was like when I fractured my hip, and you're like, it's not just your hip you're healing. It's your hip is connected to your lower back, which is connected to your spine, and your hams, and like it was like you need to stretch your hamstring to actually heal the hip. And I'm not saying it anywhere close to how you were saying it by any means, but the idea was that, like, the whole body's connected, so you can't just heal one area without healing the other, and I think it goes for all aspects of fitness and well-being. It's like, you have to think of it as a whole picture, and you can't just get so honed in on one aspect of it,
Right.
or you're gonna strain other aspects of it. So I think that's a great point. And then on the so we talked about the clinician side, but then on the patient side, where there's a lot of, like athletes that kind of listen, and we're curious, what are like the biggest mistakes that an athlete would make in recovery, and kind of what mindset or approach would set somebody apart to heal like fastest, quickest, in the best possible way versus somebody who it takes longer, or they're struggling and they kind of continue to feel the pain over time.
Yeah. So with injuries with athletes, athletes, I've come to the conclusion for sure that, let's face it, athletes work hard, but at the same time, athletes are blessed and they have a certain degree of skill and speed and strength that the average person doesn't have. So very often they're actually a lazy group of people who really, when they get hurt, don't really want to put in the time or effort to actually get better. So you have to convince them and make them understand. And I always say, like, when I'm talking to an athlete, I say, "Oh, you don't want to be that guy." And they'd be like, "What guy?" And I'm like, "Oh, remember Billy? Oh, Billy, yeah, Billy was good, but yeah, he hurt his knee. We never saw him again." Parents will always say, "I love that line because you kind of set it forth that if you don't do this, then you're that Billy who just, yeah, remember Billy? Yeah, he was good, but," and I'll say, "Look, don't look to them because this isn't about them. They're busy," meaning the parents. And I'll say to the parents, "Look, don't bring it up. Don't ask your little kid every day, 'Oh, how you feel? How you feel? You okay? You all right? You all right?'" Because the kid then is like, "I think I still hurt." You know what I mean? I go, "Just leave it alone. They'll come to you." So you have to kind of assess each kid. They're very often the quiet kids are usually the kids that are the most athletic and most dedicated, whereas the ones that come in with the parents and everybody else telling me where they're going to go to college, those are the kids that, very often aren't as good as they think they are. But I think the trick is to be able to almost put each person in this bucket of, okay, they need this much therapy, but they need this much talking to. And other people need this much therapy and they only need this much talking to. So I think really treating an athlete is kind of multifaceted depending on who they are and the family kind of dynamic.
Yeah.
What
I
about
think that's interesting too, because we were talking to Mackenzie on Friday, and she's a nutritionist, and she was saying, well, less of my job is telling them the nutrition that they need to eat, or like the foods that will help them. It's more about the talk therapy, and kind of talking them through. And in the physical therapy, where you can tell somebody what to do so much, but you it's on them to actually do it and be consistent about it. So has that aspect of the talk therapy, because that's not really I don't know, it might be, but like, is that written in the like books that you read at school, or that's probably something that's developed over a career? And how has that developed? How do you like, just what has been your experience with developing that part of the job?
Yeah, well, because I always say, I love the saying, perception is reality. So someone comes in with their perception. But perceptions are based on your knowledge and your experience. So a parent comes in with their kid and they have a lot of experience in their sport, throwing a baseball, but they don't have the knowledge base that actually throwing a baseball isn't really good for you. That's why they put a pitch count on how many pitches you should throw. They don't know that throwing a baseball, every throw is almost as much force as dislocating your shoulder. So you have to try to figure out what their perception is and then try to give them if they need more knowledge, we try to give them more knowledge. If they need more experience, well, that's kind of different. But I mean, that's kind of true almost for everything in life. That's why we're so kind of upside down right now in the world, because people have their perceptions. But I love the fact that when you say perception is experience and knowledge, but wisdom is actually, when you look it up in the dictionary, wisdom is actually when you have your knowledge and experience and you make good decisions. So I feel like that's when someone has is wise when they're taking their knowledge and their experience and they're making good decisions with it. So I think that's what you have to do with patients is you have to figure out what they're thinking of. In certain sports, I mean, not only are the parents coming in, but sometimes the strength coach is coming in with them and the regular coach. You know, the figure skating world is like off the rails in terms of how many people could be fit into a room trying to talk about this one person's injury. And really, no one really looks at it. The fact that the kids skating 20 hours a week
Yeah.
is the elephant in the room. They need to be skating less, whereas the coach wants to say this and the parent wants to say this and the other coach wants to say this.
Yeah.
So it's like you have to be the adult in the room when someone's injured.
Yeah. That's an interesting idea too. I actually didn't think of it like that. It's like in so many of these sports, you're not even putting yourself in a you're not putting the body in a state to heal. Like you're putting it in a state and you're choosing time and time after again to put it in a state that's not optimal to heal. So then you have to take it from that state to even just be in a spot that it can probably heal, which is tough. And it's I don't know, it's because in that perception, it's like, well, the more I throw the baseball, the better I'm gonna be at throwing the baseball versus how it is in your mind, which is the truth. It's like the more you throw that baseball, the more you're hurting your shoulder and the less that you'll be able to play the baseball. So it's kind of that's a tough, like, kind of thing
Sell.
to
It's a tough
yeah,
way to sell something to somebody. And sometimes people need time, with throwing a baseball. Sometimes they need to throw a baseball with better form. Sometimes they need to have a better fitness program, but sometimes they need to also be assessed whether they're throwing the right way. So it's just an interesting thing, but again, knowledge and experience. The more experience I have, like right when people walk in, I almost can tell right away who this crowd is, and I know where I'm going with this. So
yeah,
I'll say to someone, I'll say, "Stop! Listen, you paid to hear me tell you a story right now.
yeah,
Just let me tell you. You
yeah,
can leave and go. The old man's crazy. We're not doing that." But
yeah,
I said, just listen to what I say. And most often, I find parents will call me on the other side of it and say, "Wow, that was really helpful because none of us were thinking of it that way."
yeah. That's interesting. Yeah, it is. It's like I think that idea of the perspective that you keep calling out is so true. It's like that perspective shift is what you can do all the training and the exercises that you give them, but having the perspective to shift into like actually a mindset that you're going to heal is important. And then so you talked about the wisdom, which you have like what? How many years is it now? Like that you've been
You know what's
practicing?
scary is that I did the math the other day because I had to give a talk, and I graduated in '87. So next year, next spring is going to be 40 years I've been a PT.
Oh my gosh, that's crazy. That's a lot of wisdom. So that's a lot of experience, a lot of knowledge. And so when you think about that, how has the lessons that you've learned, the experiences that you've had, how what what would you say are the biggest lessons about like how the body heals and adapts over time? What would be the biggest lessons for somebody to take?
Nothing has changed. Like, the body hasn't changed at all. Like, so what's changed is people's day in their mindset and their availability to have a workout online or to sit at a desk. Or, I tell people your head weighs 8 to 10 pounds. So you carry this bowling ball around with you all day. And then if you have a job where you're holding this bowling ball like this all day, and then you say, now I'm going to go ride my bike. Now I'm going to go play pickleball. Now I'm going to text a friend. And that's why everybody walks into the nursing home
Yeah.
like
So
this hasn't changed. The only difference is in the old days, a workers' comp person used to be someone digging a ditch. And when that person came into therapy, I was worried whether they were going to be swearing or whatever else they were going to be doing. And nowadays, a workers' comp person comes in and they're pipetting over a microscope or they're
yeah,
sitting at a computer.
yeah,
The body has, for sure, even though I'm an old guy, the body has not changed in 40 years. I
yeah,
mean, maybe it's changed in 5,000 years, but
yeah,
right now, it's the same story. It's the same outcome. It's just a different story.
yeah.
So it's really interesting to watch. It's just that people nowadays have so many more resources, but they just don't know how to use them.
Yeah. It's almost like there's too many resources that it's like, which ones do I turn to? But
Huge noise.
yeah, so much noise. But that also kind of goes into we wanted to ask you about your app that you recently launched, TherexPT, because I think that's something that's where there's so many people out there. You can open your Instagram and there's people telling you do this, do that. And I think having one source of truth that is kind of going to guide you through your healing journey is so important. So I think Maggie we had some questions for you there.
and you can explain it probably better than I can, but so you're creating an app where people can do their recovery on their own in a remote setting, and I will open the floor to you to.
Yeah, that's great. Thank you for letting me talk about it. So, back when I said the internet was on paper, well, when I used to have the 22 clinics, I used to have paper sheets of progression. So if someone came in and they had an ankle sprain, they would start with ankle pumps. Then they would go to a band, they would pump the band, then they would do calf raises, and then gradually they would go on. And every injury, whether you're me, you, or Jason Tatum, we're going to start basically the same way. And it's going to go that way for the first maybe 8 to 12 weeks. And then at 12 weeks, Jason Tatum's going to go this way, and you're going to go this way, and I'm going to go that way. But really, nowadays, physical therapy, back in the day, when I first started, there were no copays, there were no deductibles, and then gradually there was a copay for $5, and then gradually this deductible thing showed up. That means the insurance company is basically saying, we're not paying. So it's like, okay, the first $1,000 you spend, we're not paying. So it just made me see that so many patients couldn't afford to go to PT. Some patients didn't have the time. I had a patient a few weeks ago that called me and said, hey, Carl, my wife has chemotherapy at the same time in which this PT practice has an opening, but I can't miss my wife's chemotherapy. So what can I do? And I said, well, I started this program. So I was able to send in the program. And then the last, geographically, in the Boston area, everybody has the chance to go to PT because there's PT all places all around. But in other parts of the country and other countries, there aren't any. So when I sold my company, the doctors at Children's said, well, what are you doing? I said, well, I'm trying to put in context all the progressions that I've always had worked with patients. And it gave me continuity of care also in the clinics because the PTs could see how everything flowed. And I said, I really want to take this to the next level. So over the last 5 years, I started the programs online. So if you went to TherexPT.com, that you can go onto the website and see all the programs that are available. And then just 2 months ago, we just launched the app to go along with it. So it's just a chance for people who don't have the time. And this is very, very often it's successful people. I'm traveling. I don't have the time to do it. Well, okay, this lays out the whole thing for you, the whole map. You'll see the whole thing. I always say PTs have all the ingredients for a program, but they don't give out the recipe. And the recipe is just you do this. Once you can do this, it's like a little kid's book. Once you can do this, then you go to this. Once you can do this, you go to this. And then, if you have any questions, you go down to the bottom of the page, you click on the email, and that goes directly to me. So a person can ask me a question as to what happens. And people are like, you are crazy. You mean you give out your email to every patient? I say, yeah, any patient. I gave my email is on the website. It goes to anyone in the whole world. So someone could actually email me, and I probably get about 6 emails a week about like, hey, Carl, you put me on this program. I went on this program, but I don't know what I'm doing. And other people will just say, should I use this program for this particular injury? So I'm really excited about it because I feel like this is my other earned secret. My other earned secret is that people can't afford to go to PT. They don't have time to go to PT, and geographically they can't get to PT. So this is an in-between step. If you have the time, the money, and the ability, go to PT. It's great. It's fun. But if you don't have those 3 things, which more and more people don't have, they can go to this website or this app on the App Store and be able to rehab either on their own, or they can take it to their personal trainer. Because a lot of personal trainers are like, the person just completely stopped coming because they sprained their ankle. And I'm like, well, these are programs that you as a personal trainer could help your patient walk through, but then they can still be doing their core and their upper body. So it's kind of like this, I think it's an in-between step that's just missing.
Yeah. And I think it's so important. There's the online apps that you're saying for weightlifting and different therapies, and you don't see it as much for physical therapy. And that's the time when it's harder for you to get, even if you have the time, the money, it's hard. I think about my mom. She broke her foot and she's up in the apartment, and it's hard for her to get down, to get into an Uber, to drive over to the clinic. And instead, she can sit on her mat at the house and do different exercises. And I think it's such a gap, and I think it's going to help so many people. So I
Yeah,
love it.
like, we could have a whole 'nother hour talk on everything related to this, how you did it once again. But we wanna wrap up today. I think one thing we did wanna ask you too is, what do you feel like a successful life looks like to you in 1 to 2 sentences when you look back on your life?
Well, remember, money is only one way of measuring your wealth. So I think that being happy is so important, number one. And then being healthy, obviously, after this talk, hopefully, is number 2. And then going out and trying to make other people happy and healthy. So if you can do those 3 things, I think you're going to be in a good place.
That's very well said.
Awesome. I think that's so true. And I think there's so many people who can say it and just speak it and tell other people to do it, but you're the epitome of somebody who actually lives by that. You're just an amazing person, and I think
Oh,
it's been
thank
so
you.
fun to kinda hear it in your own words for this past hour.
We have one more question, which is also very important. Who do you nominate next?
Wow. My nomination, I was thinking about this. And it's probably pretty self-serving, but I was thinking my daughter, Christina, who is a cardiac ICU nurse, is almost like a soldier who's on enemy lines
Yep,
and has worked so hard just to make people, when talked about COVID with her, she was just like, COVID? She goes, Dad, nobody is thinking about COVID here. She goes, they're thinking about their kids and what's going on with them. So that would be my nomination.
that's perfect. She was just put on this earth to kind of be there and heal people by their bedside, and she's truly one of the most amazing people. So that's a great one. I'm
Don't
excited.
get her to say yes, but we'll say that your dad nominated you.
Yes. Tell her that. Tell her that.
Yep, exactly.
Well, thank you so much. I really
Yeah,
appreciate you having me on.
thank you. This is awesome. Thank you so much.